This is On Diversity, a podcast series by the Institute of Policy Studies, Singapore. I'm your host, Ong So Chin. Today's episode is about sex and people with disabilities. It's a topic that's rarely discussed for various reasons. At the best of times, sex is not something one talks about in polite conversations. So, when it comes to talking about the sexual health of people with physical and intellectual disabilities, all we hear is this. In fact, most times, people don't even think such individuals have sexual longings or urges. But they're human beings too, just like you and me. Luckily, these closed attitudes are slowly changing. On Netflix, there's an Australian series called Love on the Spectrum, which follows a group of 20-something people with autism as they discover love and relationships. And years ago, I saw a wonderful Hollywood movie called The Sessions, based on the real-life story of an American writer with polio who had written about his experience with a sex surrogate, a trained female therapist who is paid to have sex with people who are disabled. We are becoming more aware that it's not enough to just feed, clean, and clothe the differently abled among us. They have sexual and emotional needs too, and we need to address, not ignore them. To talk more about these issues, I have with me today two special guests. Dr. Lohsnah Jeevanandam is Director of the Clinical Psychology Program at the Faculty of Arts and Social Sciences at the National University of Singapore. And my colleague, Dr. Justin Lee, is Senior Research Fellow at the Institute of Policy Studies, where he has examined the social inclusion of people with disabilities. Hello, Lohsnah and Justin, and welcome to the program.
Hi.
Morning, So Chin.
Lohsnah, let's start with you. How did you become involved in working with people with disabilities?
Okay. In the early 2000s, I joined the Movement for the Intellectually Disabled of Singapore as a psychologist. Now, it was meant to be a one-year interim job just to fill up my time before going off for my postgrad studies, but I enjoyed it so much that I did my postgrad studies, and then I came back and I worked for them for about 8 to 10 years. And that's kind of where my love for the work of intellectual disability began. Mm-hmm. And then since then, I've been doing some training, some research in that area. But I want to talk more specifically about sexuality. And what got me alarmed in the early days was that I would have clients coming to me saying, so-and-so, someone touched me on the bus, on my buttocks, or someone grabbed my breasts. And then I had a few more clients coming up to me by the week, by the month, reporting some of these incidents. And that got me really alarmed because clearly my clients were vulnerable and they didn't have the skills to keep themselves safe. So that really got me interested in the area of sexuality education.
Right. Justin, what about you? What have you found in your work with people with disabilities? I think Lohsnah has mentioned the vulnerability aspect as well, but are there other aspects to this?
There was an interesting 2018 NCSS survey on the quality of life of adults with disabilities. And out of many things, generally the findings was that people with disabilities feel less satisfied with their lives in all kind of aspects. But of particular interest to today's topic is that they also feel that their sexual needs were less satisfactory compared to the general population.
So there's actually two things here we're talking about, right, when it comes to sexuality of people with disabilities. First, there's the understanding and the awareness so that they don't get exploited. And there's also the acknowledgement of their own personal needs and longings, right? So is there a gap in how we teach sex education to people with disabilities?
Well, as a starting point, we have traditionally looked at sexuality education from a very risk or protective approach rather than a rights-based approach. And what do I mean when I say that is that it's about teaching just enough to keep our clients safe. So which means if you're on the bus, if someone touches you, you push their hands away and you walk away. Or don't go into the lift when there's someone else in the lift.
Right.
So it was really about what you don't do so that you don't get sexually abused. But it was not about what you can do to achieve fulfilling relationships, how you can have meaningful and social or even perhaps intimacy. So that is probably the primary gap in our teaching, which is that it tends to be more risk-based approach.
So it's more defensive education, right? So we've gone some way in that field, have we?
Yes, I must say that the Ministry of Education Special Education branch, I must applaud them. They organized a fairly large-scale training last year for special educators. And so we had about 60 educators being trained by myself and another trainer called Glenn Quinn. We had a 3-day workshop. It was very well received. Some of the feedback was that professionals felt that they were now equipped with the necessary knowledge. They felt that they could do this. And we ran another series of workshops just in the past month. So I do feel that at the ground level, there's beginning to be some momentum in terms of rights and pushing for sexuality education aggressively.
Right. But the other aspect, the other half of sexuality education, which is sort of validating your own sexual longings and urges and needs, how far along are we on that?
I would say still a far way. And I'm thinking, well, there's so many aspects to this. And so let's start bottom up, which is first teach our clients about social relationships, about how they can have meaningful friendships. Because sexuality is really about self-esteem. It's about gender identity. It's about decision-making. And so there's so many aspects to it. So we really should be thinking of it more as a pyramid where we have broad range of skills that everyone should be taught, and then we slowly work our way up. For example, only a small group of clients may ever need information about safer sex options, for example. But at the base, it would be about decision-making, self-esteem, body awareness. So I look at it as a more systematic approach.
Right.
Actually, I've never had sexual education when I was in school, and my kids are too young, so I don't know what's going on in school right now. Could you kind of walk me through what's taught? Because are you saying that now we teach the kids a lot more about self-esteem and all that?
Well, okay, with MOE mainstream schools, sexuality education starts when they're P5. And it's about, body parts, it's about reproduction, it's about family values. So certainly I'm glad there's a lot of good information education. Although my opinion is that it should start before P5 and it should start as early as P1. I mean, when my kids were in K1, K2, I taught them what was penis, what was vulva, so that they'd use the right words and not refer to it as the bird or anything else.
Right.
But Justin, talking about what kids learn, the truth is that they learn very young. I had my 9-year-old a couple of months came back to me and she said, "Mommy, I know what sex is." And I was like, "Okay." And I said, "Okay, what do you understand?" And she said, "Well, if it's two children," she said children, "go into the toilet, they remove their clothes, they touch each other and they kiss each other."
Oh.
And she said, "That's sex." And I'm like, "Okay, at some point I need to teach you."
Yeah.
But the point is that she's in P3 and she understands this. And now if she had to wait till P5, clearly now that would be a gap. So now, clearly I can educate her, but I wonder how many P3 kids out there are not having the information.
Right.
And they're turning to social media to fill in the gaps.
Yep, that's a danger indeed. Yeah. So obviously, there's a gap in mainstream sex education. I would imagine there's a bigger gap in sex education for people with disabilities.
Yes, there is so many gaps. One is understanding. One is discomfort among educators to teach.
Is it because we're quite conservative? We're embarrassed to even regard, or we don't even see people with disabilities as people?
So sexuality is a taboo topic, and it's not something that you would openly discuss, let alone even with your family members. Now, if we layer that with disability, now that's a double whammy, because here you've got someone with disability thinking about sexuality, and now how are they going to transcend all of those societal discomforts and attitudes. And so therein lies the challenge, because you've got some educators feeling like, yes, we should do this. But then again, some educators feeling like, no, this is not right. This is against my value system. And if you've got caregivers who are very uncomfortable, you've got aunties and uncles who are 70 years old. And how do I talk to them about allowing their son to masturbate, for example? And they roll their eyes and say, "Lohsnah, you can't be telling me something like this." And I'm like, yes, but I do have to.
Yeah, exactly. So do we need to differentiate between intellectual and physical disabilities? Obviously they're very different. So what is being done in each space?
So with intellectual disability, that's kind of what I referred to earlier with the Ministry of Education organizing workshops. And intellectual disability rather is about someone having a bit more difficulties with problem solving or logical thinking, as well as some difficulties with adaptive functioning, so perhaps care of themselves or being able to navigate community resources. So with a person with intellectual disability, it's about if someone makes advances, how do I know if it's genuine or if it's fake? How do I plan? How do I, it's about being able to think through, and sometimes there's deception and falling prey. So, for example, I had a client a couple of years ago who went missing, and when we found her in Geylang in one of the budget hotels with a few workers. And I said, "Well, what happened?" And she said, "Oh, they were really very nice to me, and they bought me food, and they said I was beautiful, and they spent time with me." Now, she was quite a lonely girl. Her parents work late hours. So for her, the whole experience met many different needs. It helped her feel good about herself, her self-esteem. It was a means of being able to have access to some food, some nice, good food.
Right.
And she enjoyed the sexual intercourse as well. And she said, I enjoyed that too, and they were very nice to me. So sexuality is really about, this quite clearly shows it's about more than just simply about the physical aspect.
Right. Yeah, it's about setting boundaries, teaching them to set boundaries and to understand, right, what everything means in that space. What about physical disabilities, though? That's a different issue altogether.
Before this, I chatted with some people at Disability Facebook group, and quite a few of them pointed me to this YouTube video that they said changed their lives because these were teenagers talking about sex and disability and they were facing the same issues. And one quote from a particular person struck me. This person was talking about sex education. She said, none of the bodies in any of the sex education videos resembled mine or related to the body that I have or what I can or cannot do. And I'm looking at these bodies and thinking, I'm not going to be able to do that. So that was interesting to me in the sense that we take these things for granted, right?
Yeah.
Sex education in the mainstream school, this is how it works, right? These are the mechanics of it. But there are people who have diverse bodies from us.
Yeah.
So I was wondering, Lohsnah, do you have any thoughts on will we be able to respect the diversity of the way that people interact with their bodies?
I mean, Justin, you make a really good point about the fact that it's very hard to generalize and learn from social media and everything out there because everyone looks so different. So it is true that we need to be more conscious about publicity materials that is really inclusive of diversity, really. You're short, you're tall person, you're tan person, you're fair person, people with abilities and difficulties. Absolutely, Justin, I definitely agree with you on that.
Yeah. So I'm just wondering, are there lessons we can learn from other countries? How are other countries approaching this issue? Because I mentioned this movie that I watched called The Sessions, which really opened my eyes. I'd never known about sex surrogates. So that was something really new to me. And I'm quite sure it doesn't really exist in Singapore right now. But what's going on in other countries?
Well, there's a group called Hand Angels in Taiwan.
Oh, okay.
It's a non-profit group, and they go around helping to masturbate people with disabilities who cannot achieve sexual gratification on their own. And so there's a lot of controversy about this because people regard this as, is it a
sex work,
prostitution in disguise?
Right,
is it sex work? Or should we consider it as a kind of medical or therapeutic work whereby you're a sexual surrogate? So that's really the question in my mind, is, well, I'm all for it, right?
Yeah.
I think sex is an important part of who we are.
I guess maybe if it's supervised by a doctor or something, I'm not sure, or some medical
I don't know
professional.
that you want a doctor to
not
supervise you.
But in the Sessions, the movie, client was referred to a sexual surrogate by his therapist. So there was a process involved. I'm just mindful that there's a need to prevent abuse on either side. Maybe there's something that could be done there. Or do you think maybe they should just have their own agency to just go?
I think it's easy to, because the medical model is so comforting, right?
Yeah.
Treat this as a medical problem and there's a cure for it. So we rely on the doctors or therapists.
Right.
But if you don't want a doctor in your bedroom, do you think the person with disability wants their issues to be medicalized?
Right. Yeah, but I guess maybe what would help if more people talk about it and there's greater awareness and discussion among various groups. In the Netherlands, they're always very advanced in the Netherlands. There's funding provided, right?
That's right. In the Netherlands, the government actually provides some money and fund for sexual services up to 12 times a year.
Wow. Okay.
And that can be any form of sexual services, including someone to spend time with you or any other forms of sexual intimacy.
I think that's a really good benchmark. You're supposed to have sex 12 times a year. Right,
once a month, yes.
So we all know whether we're meeting our basic session.
Let's not even go there.
Yeah, so that's really a very advanced way of thinking. How do you think that will sit in Singapore? Are we ready to have this kind of discussion?
Well, I think it's not a matter of whether we're ready, but we need to be discussing some of these realities, which is that we already have individuals with disabilities soliciting sexual services. So it is happening. So instead of turning a blind eye, I think it's about how do we manage it and how do we go from there? Because the truth is that we could have a situation, someone's earning money and they could be spending it all on sexual services. But also, do they know about safeguarding?
Yes.
Also, about not falling in love with the person. And so who's guiding and supporting them?
Yeah. Gosh, yeah, this is a big thing. Do you think, are there any studies that are being done? We're talking about people with disabilities already visiting
Not that I know in Singapore, but I do know of clients who have shared with me or care staff have informed me that they do go off on the weekends. So it is happening. So I think it's just a matter of how can we start thinking it through and how do we manage it.
Yeah, and not sweep it under the carpet.
Absolutely. Actually, talking about sweeping under the carpet, there's another area that's quite big, which is lacking as well in just mainstream dialogue. dialogue, which is about what we refer to as sensitive topics. And these are topics about abortion, contraception, homosexual orientation, premarital sex. These are topics that are, while we call them sensitive, they're actually real topics. And these are topics that we need to have open dialogue about these, because how else would we teach our students and young people about some of these important decision matters?
Yeah. The students are definitely ready, right? I mean, people are definitely ready. Young people are definitely ready to talk about these things. But are the teachers ready?
Sometimes the teachers are ready, but then they feel that the administration has different views, or the organization subscribe to a certain value system, and so therein lies another challenge.
Yeah, that's the thing. I mean, we have to be sensitive to all sides, but I think if the reality on the ground is if young people are already interested in these topics, if they're already experimenting with their sexuality, it does nobody any good, really, to sweep things under the carpet, right? And we need to have this open discussion, because there will be ramifications. There are self-esteem issues, if there are legal issues that come out of this. Yeah, if we don't talk about and address these issues in time, right?
And talking about something doesn't mean a decision has to be made about whether it's good or bad. It's just simply talking and presenting both sides of a coin. And I think that's a more mature way of looking at education, which is I present both perspectives instead of having our young people figure it out on their own.
Right. So who needs to start talking? Who are the stakeholders that need to start this conversation? I'm assuming the schools?
The schools, the higher administration.
Parents,
absolutely are a big part of this equation.
Yeah. Parents like yourself, Lohsnah, I mean, you're talking to your kids, right? I mean, when they come to you, you don't shy away from the issue.
Yes. In fact, it's my 9-year-old that gets quite shy. She's like, it's okay. Mommy teaches these things.
I'm dreading the day when my kids grow up and ask me about these questions.
How old are your kids, Justin? How old are you?
I mean, one is 4 and one is 1, so there's a ways to go. But
you can send them my way, Justin.
So are you saying I should subcontract out?
No, you should do the work yourself, Justin. Come on.
Yeah, so I'm asking, how do you have that conversation? Do you broach it or do you wait for your kids to broach it?
A bit of both. With private parts, I taught her about what the names were, and I also taught her about safety. So if someone touches your thighs or someone touches your buttocks, what do you do? So I taught them that by the time they were age 5. Now, with the other topics like sex, now I waited for her to bring it, and now that she's brought it to me, I gently check in with her. And then so she says things like, oh, my friends are so dirty-minded. And I'm like, did I even know that expression at age 9? I don't think so. So I was like, what do you mean by dirty-minded? But I think that the takeaway for me is that I'm so glad that she feels safe and she's willing to come to me, because who else can give her, more accurate information than myself? So I'm so glad about that.
And I think there's something to be said about, I think kids will come to you when they're ready. When they're not ready, they're not really interested. And this is my own personal experience, because when I was really young, I'm assuming, I think I was 5, I can't remember, there was a Ladybird book lying around about male and female parts, right? Anatomy book. And there was drawing of a man and a woman with all the parts labeled. And I remember looking at the book, and it said, sex happens when the man puts his penis in the woman's vagina. And I remember looking up, okay, where's the penis? Where's the vagina on the drawing? And I'm like, oh, okay. And I thought nothing of it after that. I mean, it was something strange and new to me. So I remember it to this day. But I don't remember thinking, oh my God, it was dirty. It was, is this what happens? It's so revolutionary, right?
That's so funny, because that's exactly how, so my mom was supposed to have that conversation. My brother said, do you know what sex is? And he brought me to my mom. And we're going to have that conversation. And then the phone rang or something, right? And then she left. And then my brother was the one there. And then he decided, I'm going to tell you, it's when the man puts the penis into the vagina. And my reaction wasn't like, oh, my reaction was, ew, yucks.
You see, you needed a Dr. Lohsnah then to set you straight. So, okay, I'd like to turn the focus around. We'll be talking about helping people with disabilities. But is there anything we can learn about sex and intimacy from people with disabilities? Because they experience and perceive things differently, right? What do you think, Justin?
I think this is really interesting because I study a bit of arts and disability. And I think in the art world, there's often this norm of either, okay, it can go either way. You can use art merely as a diversion. Use art, it's good for you, it's good for therapy. Or you can use art as a means of expression. And the people who do it seriously say that disability arts expands your aesthetic horizons. You used to think you know what dance is, but have you ever seen people with crutches or wheelchairs doing dance? If you've never seen that, then you don't know what it is, right? And so kind of parallel to that, do people with disabilities express intimacy and romance and do sex in a different way. And there's something that we can learn from them.
Right.
And I've always been curious about that.
I think the whole point is just to see things in a more inclusive manner, right? And include people with disabilities in this conversation about sexual development, sexual education, and not try to have people conform to certain stereotypes, right? So just moving the needle, I guess I'd like to ask for your wish list. How we can make things better in this space and improving sex education for people with disabilities.
This is a vision I have, which is back in the 80s, there was a unit called the Social Development Unit.
Yes.
SDU, where people would go to meet other singles and they would meet and then date and then perhaps get married. And something similar to that for our disability colleagues. And it could be an agency that provides disability-friendly online information, face-to-face consultations for people who are dating or who want to get married, counseling for parents. It could be financial schemes for married couples with disabilities, genetic counseling if they want to have kids, social networking events, naturally, training for staff and caregivers.
So there's nothing like that right now?
No, there isn't. So it's a one-stop place where it is an amalgamation of services to support healthy relationship building for people with disabilities or all disabilities.
Are you going ahead with that? Are you going to push this?
It's something that I have broached at different platforms. At the same time, this is something that would need to garner support from all different levels.
Right.
But I also do believe that by just working at it and chipping at it slowly, I think, at some point somewhere we will get there.
Right.
I feel quite torn about specialized services like that because even in the employment space, sometimes people suggest, let's build a employment matching service for people with disabilities. And then the people with disabilities don't want to go there because they want to go to Monster, they want to go to jobsearch.com or something.
Right.
Because
they want to go to the regular portals.
Yeah, why are you saying that we can only date other people with disabilities? So there's the danger. I recognize that the specialized service, I think this wrap around the service provision would be wonderful, but there's always that danger of creating a special service for special people that creates a kind of label that I wonder if it always works. It doesn't mean that you have a special service for them that it will necessarily be segregating, but I think the boundaries must be porous enough so that the mainstream can enter and you can also go out of the boundaries.
Yeah, obviously this needs to be planned carefully, and you're right, Justin. I mean, I think we need to have that special facility or special services, but of course not to make it so segregated from the rest of society that feels that they're not included in the regular space. I guess a bit of both would be good.
Yes, because if not, I guess you risk propagating the message that only people with disabilities can only ever marry people with disability. And you're right to say that, that's not inclusion too.
Yeah.
So I think it is a tricky balance. It's about how do you create a service that reaches out, but it's also inclusive in every aspect. So it needs to be well thought through.
So how do we start this, Lohsnah? How are you starting things on the ground to move the needle in this space? Who do we need?
We need all hands on deck.
Yeah.
MOE SPET branch has taken the first bold move, and I think that's good with training. So that needs to keep going. We need more active support for educators. While we are training, these are small numbers.
Yeah.
So we need more training, we need more resources. I suppose provision of funds in this area.
You need advocates, right, as well? Right?
Absolutely. So we need advocates, we need caregivers on board. We need the administration, the schools, and actually even society at large. Because if people are scorning at two people with disability holding hands, that's also a challenge. So how do we have messaging out there? Sexuality is a right for everyone.
So what about funding, though? Would that be difficult?
I think it's important to carve out especially funds for this area because, you need to acquire materials, you've got to get training. Thereafter, there needs to be constant supervision and consultation. So there needs to be designated funds for this area.
Now, you did mention the pilot project that you're trying to start on this.
What I'm planning to do right now is to run a pilot project on a small group of students at the social services to run a sexuality education program and take them through comprehensive education. And I want to assess the outcomes at baseline and after the program, and hopefully at 3 months and 6 months follow-up to see if the gains have been maintained. And this would be a good indicator for myself and the special needs services about which aspects of learning can be more concrete or rather learned well and are maintained. But also to be able to run and see how resource intensive it is.
Right.
So that then I can pitch forward a proposal about how it can be sustained in a more practical way. So while there is quite a lot of materials out there, the challenge is that how do we generalize some of these materials locally? So I've got pictures of boys and girls with blonde hair and red hair. And, if I show it to my client, they're like, oh, that's strange.
That's not me.
Yes, exactly. So it's about how can we develop materials locally that suits our own clients, as well as how do we bring up topics within the local context and talk about topics such as sexual intercourse, for example, in a culturally appropriate way.
Right.
So I am planning at some point to be thinking about working with the schools to develop and put together some sort of a curriculum.
Yeah. I think you mentioned culturally appropriate. I think the important thing is to make it evidence-based as well, right? And science-based. So you sort of remove the emotional elements, perhaps,
I guess
from this.
prior to all this is whether we as a society consider sex even as a primary social need that we would even care to pilot or fund something about. Because actually, if you think about it, social or basic needs is not as easy as it seems. You think housing, you think healthcare, you think education.
Yeah.
But the bar is always moving. If you think, okay, we should create employment opportunities for people with disabilities, should they just be viable employment or should they be desirable employment? If our employment rates are low, then, we think, well, that's the practical target. Let's get them viable jobs now. But if many of them are employed, then we think, that's not enough. We want to get them jobs that are desirable, that gives them a livable wage, etc. And so even things like sexuality, we don't currently consider it as a basic need. So the question is, should we? And that's the larger conversation before any money would be put into anything.
Yes, I think that's definitely something to consider.
So I wanted to ask Lohsnah, do you think sex is a basic need? On par with health and food and security? Or it's something you can actually do without? Or something in between, 12 times a year?
12 times a year, that's enough.
Okay. If I was to strictly think about basic needs, now these are food, your water, your air, your shelter above your head. Now, which means that if I don't have these things, I will perish at some point, right? If I put that on par, then say sex is not a basic need like food and water. Having said that, sex is a right. I would like to look at ourselves as sexual beings because it's not just about sexual intercourse, but it's about if I'm a well-functioning sexual being, I can engage in friendships, in relationships, in intimacy. I have good self-esteem. So I look at sexuality as part of my being. And so really it's not something separate. And so if I look at it that way, it has to be a right. I need to be able to flourish and empower my sexuality. And so it's almost like there's no discussion for it because as much as I would like to teach my kids English and math and how to read and write, I need to teach them about sexuality as well in every sense of it.
Yeah, because they're going to learn about it elsewhere anyway. So it is a basic need and it does happen to everybody, whether we like it or not. So anyway, I think that's a positive note on which to end our discussion today. Thank you, Lohsnah and Justin, for sharing your insights with us. And thank you for listening in. See you again in our next episode of On Diversity.
Thanks, Ho-Chin.
Thank you.
On Diversity is a podcast inspired by the Institute of Policy Studies Managing Diversity's research program. We're available wherever you get your podcasts. Swipe on the cover art to see the show notes for more info on this episode or visit us on our website ipscommons.sg. Do subscribe to be notified when we have a new episode, and if you like what you heard, tell a friend or give us a 5-star review. It really helps other people find us. I'm your host, Ong So Chin, reminding you to always keep your body healthy and your mind open. Goodbye.